Hi, and welcome back to Live Well with Dr. Mel. I'm Melissa, licensed physical therapist and holistic health coach. If you haven't yet subscribed to my channel, go ahead and click that subscribe button. You'll get access to all my free videos and physical therapy tips and tricks. In this video, we're going to go over herniated discs and radiculopathy or sciatic symptoms down the leg, how to start to localize those symptoms to the center of the back, and then eventually eliminate them altogether. You have to stay consistent with the exercises, and also I recommend you consult with your doctor and a licensed therapist in order to make sure these are going well. If you're ready, let's get started. So your spine should be in a nice S-curve where your head's directly over your shoulders over your hips. But what happens with use of phones and computers and driving or writing at your desk, you begin to develop this C-curve. And what happens when your spine is rounded like that, it puts pressure on the fibrous discs in between the vertebrae. When you put too much pressure on one side of the vertebrae, it begins to squeeze out the backside and putting pressure on the nerve. Look at the picture in the demonstration. You see how that nucleus pulposus in the middle of the fibrous discs is beginning to push out like a jelly donut, squeezing all the fluid into the spinal cord, pressing on the nerves. Because of our posture being rounded forward and putting too much pressure on the anterior aspect of our vertebrae, leaving an opening for the fluid to squeeze out, the posterior aspect, the back of the vertebrae, pressing on our nerves. Once too much fluid is pressing on the nerve, then you start getting nerve pain, back pain down the leg. So our goal with these McKenzie exercises is to bring the vertebrae back, pressing it back to allow that fluid to come more centralized in towards the center of the spine to take that pressure off the nerves. So when somebody comes to me with back pain or sciatic symptoms and radiculopathy down the legs, I look at their posture first. If I draw a plumb line from the top of their head down through the center of their nose, down through the center of their chest, through their sternum, is one earlobe lower than the other? Is one shoulder lower than the other? A common tendency I see is for righties who spend a lot of time at their desk, they have a tendency to lean more to the right, and they have sciatica symptoms down the left leg because being crunched on this side, like I said earlier, what's going to happen to the disc if you're leaning to the right? The discs on the right side are going to come more together, pushing that fluid out towards the left, pinching those nerves, causing symptoms down the left leg. I'm going to show you an exercise to help with this. So if you found that you do have a pelvic lean, this exercise is for you. It's called a pelvic glide. So you're going to bring the limb that is uninvolved towards the wall. So if you're having symptoms on the left, you want that leg on the outside, away from the wall. Bring your feet together to touch, about 6 inches away from the wall. Bring the arm across your belly and then just shift your hips, pressing into the wall for 2 to 3 seconds. And then you just bring it back center and repeat this 10 times. What this is going to do is it's going to condense that space on the side that you're having symptoms, allowing the discs to press together to allow the fluid to come in towards the center. Because of your posture, you've been opening that side too much. So what we need to do is shift our hips to the right in order to condense the space on the left to bring the fluid to the center in order to relieve your symptoms. After doing this 10 times for 2 to 3 second holds, reassess, see how it feels. It should feel slightly better. If it does, continue this over the next couple of weeks. If your symptoms are on the right because you lean to the left, just do it on the other side. So now that we addressed that postural lean, we need to address that forward C curve. Like I said in the beginning, when you curve forward, you're more likely to continue to bulge discs. So be very careful when you go to pick up stuff. You don't want to be rounded at the spine. You want to keep your spine nice and straight. The more we move into extension, extending the back, we're able to press down on the back of those vertebrae in order to push the fluid more central. So what happens from that C curve, we're opening the vertebrae in the back and the bulge is going more towards the spine. Now we want to extend to allow the back vertebrae to push in to get the bulge to come back in center. So the way we do this is to get into a prone position, so laying on your belly. Some people really need a lot of support under their hips when they first start this because it's really painful. I've used 2 to 3 pillows on some clients, but eventually you want to get to the point where you can lay on your belly without anything. So you start with as many pillows as you need right under the hips. And then you try to lay here for about 3 to 5 minutes. You see, with the pillows underneath my hips, I'm in more of a rounded position. I'm not in full extension of the back. Eventually, as you want to ease into extension if it's difficult for you. So then you start removing one pillow at a time to put the back more into extension. Till eventually you don't need any pillows at all. And you can lay here flat. You can always progress to another level, right? So we want to go next onto our elbows. This is going to give us even more back extension. Make sure your hips are down though. If those hips are up, you lose that extension. You want to get that spinal extension to press the vertebrae together posteriorly to push the fluid back in towards the center. Once this is comfortable on the elbows, you're doing this for no problem. You can stay here for 30 seconds. You want to progress to hands. And you can place the hands just at the nipple line, squeeze the shoulder blades in, and this will also replicate in yoga a cobra pose. So zip those legs in and then press up here, squeezing those shoulder blades together, pressing them down the back. And if this is causing you pain, don't do it. Go back to the elbows. You're not ready for this yet. So just hold it here for 10 seconds and then lower down onto your hands and rest in between. I usually recommend to my patients doing 10-second holds, 10 reps for that one. Once that gets easier, you can get even higher through your hands. So hands at your nipple line, neck straight, legs zipped in together, and lift up into full cobra. Hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lower down slowly. Same thing with that. Hold for 10 seconds, repeat 10 times. So following your spinal extension exercise, do an assessment of the body. See how it feels. If it feels good, I want you to continue doing the exercises 3 to 5 times a day. I have some patients that do it 10 times a day because it feels so good. If your symptoms are getting exacerbated and you feel more pain after the exercise, stop. Consult with your doctor. The next set of exercise are for spinal traction. So when your vertebrae are compressing, pressing down on the disc, what we want to do is distract them from each other, providing more space so you're not pushing down on that disc and bulging that disc more. So by spreading them back apart, you're going to allow the fluid come back center. The way we do this, we can just do it at the door frame. You don't need any fancy traction equipment. So standing in between the door frame, you're just gonna reach up for the top of the door frame. Pretend you're a human bungee cord and you're gonna try to spread apart, reaching your hands up towards the ceiling, pressing down through your feet. Try to make sure that your weight is even through both sides, that you're not leaning too much to the right or too much to the left. Stay centered and hold this and keep stretching for 30 seconds. If it's difficult for you to do this for 30 seconds, just do it for 10 and repeat 10 times. Or if you can hold for longer, hold for longer. Hold for 30 seconds to a minute. To advance this, grab the top of the door frame and then hang. Let your knees bend. Let everything stretch and just breathe. You can close your eyes if you want. It feels good. You get a stretch through your whole body. Not only your low back is stretching, you're also getting a stretch through your armpits and shoulders. Everything's stretching out beautifully. And same thing here. You can do 10-second holds, repeat 10 times, or you can just hang there for 30 seconds to a minute if it feels really good. So I wanted to finish in a final resting pose to help with your spinal alignment. Like I said, we'll naturally fall into the C curve during the day, and we want to get into that S curve. The best way to do that is by putting your feet up onto a chair and laying flat on your back on the floor. So just place your legs on the chair, scoot your butt as close as you can to the chair, so your knees are over your hips. And then by laying here, we're naturally in that S curve, no longer in that C curve, because gravity just pushes us down into that proper alignment. And you can just rest here and breathe here. It feels so good to finally off weight that low back. A lot of my clients too enjoy if I add a heating pad to the back or an ice pack, depending on the person. If you like the cold, add a cold pack to the lumbar spine. If you like the heat, if that helps you and that feels good, add heat to the low back while you rest here for 3 to 5 minutes. If you have difficulty getting on and off the floor, you can do this from the bed or a sofa and just use pillows stacked up to get your legs in that proper height so it feels good and off weighting the low back. Well, I hope you enjoyed the content that I shared today. If you haven't yet subscribed, I love when my viewers subscribe, so please subscribe. Also, if you're looking for more exercises and you have a weak core and you need to strengthen your core, check out my dead bug video. Also, if you're having piriformis tightness, and that could also contribute to sciatica, so check out my video on stretches for sciatica. Well, thank you so much for watching. Stay healthy and well, and take care. I'll see you next time.